My department is watching the situation closely. We'll let the public know if and when we see cases here in Alberta, and when we know more about what's causing them as well. And we'll take any action required based on the advice of medical experts.
Alberta announced today, as you heard there, it's reviewing rules around vaping. And Nova Scotia's government says it's considering a ban on flavored vaping products. That's after U.S. health officials recently reported at least 12 deaths and 850 cases of lung illness related to e-cigarettes. Several similar cases have now popped up here in Canada. Ontario is among those provinces affected. So will that province consider changes, maybe even a ban? Christine Elliott is Ontario's Minister of Health. She joins us now from Toronto. Hi, Minister Elliott. Nice to see you. Thank you for making time.
Thank you. Pleasure.
Minister, can you update us on the number of cases you're aware of, vaping-related illnesses, the number of cases that you're aware of, rather, in Ontario right now?
The only one that we've heard of that's been reported through the hospitals is the one that Dr. Mackey reported on in the London area several weeks ago. That's the only known case of pulmonary lung-related illness as a result of vaping so far.
I know earlier that you said you're tracking that data, that you want more data before making any kinds of decisions on further restrictions or any more action that the provincial government might take. How long will you be tracking that data for?
Well, we're going to be tracking that data, but I can tell you that since I issued the order several weeks ago, I have heard from a number of people, including parents of young people who have been vaping, who have some pretty serious health effects as a result of it, but they're afraid to tell their parents because they're afraid their parents will be upset. So my concern is that we're not getting all the information about what's going on with vaping just from what the hospitals are telling us. We really need to take a step back, and I am putting together a panel of people, including teachers, parents, young people that have knowledge of what's going on with respect to vaping, to understand what is causing this problem out there that before it gets to hospital, because I am very concerned and that there are a number of ill young people out there right now that have not gotten to the point of even seeing their family physician, never mind going to the hospital. I want to understand what's going on with those young people as well, because if we want to make good evidence-based decisions, we need to understand exactly what's going on out there. And I'm collecting that data now because it is a matter of urgency for many people. We are taking action on this.
Do you really need, Minister, to collect more data? I'm looking at right now a study from 2018 that lays out evidence of dangerous vaping rates among teens. The study was led by a professor out of the University of Waterloo. It found that between 2017 and 2018, among 16 to 19-year-olds, vaping increased by 74%. What more do you need to know before taking action?
I know it is a serious concern. I've heard from one parent who suggests that in her child's school, probably 98% of students are vaping. But we need to understand what are the products that are causing the problems. We know that there are some situations where people are getting these products through convenience stores and some other ways of getting it. But we also know that there are some young people who are using counterfeit ID to go into vape shops to buy products. And we need to know what products people are using. We need to know whether they're mixing it with other things like ingesting cannabis oil as well. We don't really have a full understanding of exactly what's going on with our young people out there right now. We know a lot of young people are vaping. We know there's a lot of illness that seems to be resulting from that, but we don't have the entire picture under control. And so before I run off and start making rules and banning things, I need to know what is happening out there so that we can make good evidence-based decisions.
I think
so while a lot of people have suggested we should be doing this, that, and whatever, I think it's really important for us to understand the full nature of the problem and then develop solutions that are going to deal with that problem.
I take your point, but I mean, banning is only one aspect of it. There's another piece of legislation that's already on the books. My understanding is your government actually delayed regulations that had been passed under the former government that would have just made sure that vaping products are stored the same way tobacco is, behind a counter or behind a cupboard. Why did you delay implementing those regulations, and are you taking a second look at that given these statistics and given what you're hearing from parents?
We're going to take a look at everything because we want our young people to be safe and healthy. And I'm very concerned right now that a number of young people are becoming ill and they're not seeking the help that they need. So we want to look at anything that's going to protect them. But we really need to understand exactly where the problems are happening, what's causing these problems. What is it that young people are vaping? What's causing these health concerns to crop up?
With respect, at the time, there was already evidence that there was a 74% increase in teen vaping. All the regulations would do is require that vaping be treated in the same manner as tobacco.
And there may be we may need to come and take a look at that, but what I can also tell you is that I know from conversations with parents who've had these discussions with their children that a lot of these products are not even coming from convenience stores. They're coming from other locations. So we need to know what's going on there. So while that might be part of a solution, it would only be part. We want to come forward with comprehensive solutions that are going to make sure our young people are safe and healthy and that they come forward and get the health care that they need as soon as possible.
I understand that, though. This is something that was on the books as of July in 2018, though. We're talking, over a year later, when you're now deciding that it's something that is worth looking at a suite of measures. You had the chance to make it just a bit harder for kids to get their hands on this, and you declined that chance at the time. You delayed the implementation of those regulations. Is there some responsibility there on the part of your government?
No, I think what we've discovered right now, this is quite a recent phenomenon. I think we have to realize that this has grown exponentially in even the last 6 months. And this is happening when we don't really understand all of the health effects for young people. We do know that a number of them are becoming ill, but we need to understand what exactly is it that's causing this problem. What are the vape products that are causing the problem? Are they being mixed with other things from the street that it wouldn't really matter what kind of advertising was happening in convenience stores or what they have available or not? Are they mixing it with cannabis oil or something else? We don't know. So we are actively seeking out that information right now. We know this is a matter of urgency to the people of Ontario. We know that many parents are concerned about this, that schools are concerned about this to the point that they're looking at closing the washrooms in the schools. We know that action needs to be taken, but we can't just come up with ideas that don't make any sense with respect to what the problem actually is. I want to make good evidence-based decisions, and I need more information, as do many other people in the province that are suggesting that we come up with all kinds of bans and ideas right now. With respect to them, they don't know anything more about this than what we know right now, and we're collecting this information in the ministry, and we are giving this priority. This is something that is very serious to us, and we are going to come forward with solutions that are going to make sense and keep our young people safe.
Okay, I do want to switch topics before I let you go and ask you about vaccinations. Just quickly on the point of it being a new phenomenon, I would point to the fact that that study that I brought up about the 74% increase was from 2018. On vaccinations, though, last month Toronto's public health officer recommended only allowing medical exemptions from immunization programs. So that would mean essentially no more exemptions based on religious or philosophical grounds. Are you considering making that a province-wide policy?
No.
Why not?
No, I think that there are some because there are some religions where that is really important, that they are object for specific reasons, and we need to understand those reasons. Again, it's not a question of banning things or refusing things. We need to know exactly what's causing the problem. I understand that there are religions that do have concerns with respect to it. Would I like everyone in Ontario to be vaccinated? Absolutely, I would. I think it's really, really important. We do have that necessity of the sort of certain members of the herd mentality that a certain percentage of the population needs to be vaccinated in order to keep everyone safe. But I think what we have right now is a process of education for people. We need to understand what people's concerns are. In some cases, we may be able to eliminate those concerns, but we need to have that conversation with people. And would I say that we should not allow people to object for religious reasons? No, I would not say that.
Herd immunity, the goal for herd immunity is between 90 and 95%. In the city of Toronto, only 76% of students who were 7 years old during the 2017-2018 school year were immunized for measles. In the 18 months, I think, leading up to September of 2018, between September of 2017 and April of the year after, so about over an 18-month period, 16 public health units issued more than 6,700 non-medical exemptions. Does that number not concern you?
I've always been concerned about the vaccination rates across the province of Ontario. I am urging everyone to be vaccinated. I'm urging everyone to get the flu shot too, because it's a matter not just of your own protection and your own rights and so on, but it's about everyone else as well. Of course, I would be concerned about that, but I believe at this point it's more important to work with people. The education piece, I think, is really important so that people can realize that while there may be some specific concerns to them for religious reason, maybe some of those concerns are based on something else as well. So we need to talk to people. We need to understand why they are resisting vaccination. And I'm going to continue with my appeal to everyone to be vaccinated. It is really, really important for the overall health of all of the people of Ontario.
Okay, I'll leave it there. Thank you, Minister Elliott. Appreciate your time today.
Hey, my pleasure. Thank you.